Okay, continuing this panel, okay, I would like to thank all of the presentations by all the participants. Please remain with your cameras on so that we can have a panel discussion, okay? It was rich in experiences, it was rich in culture, it was rich in examples, and everybody is very curious about the event. So we pre-selected a few questions because, as we mentioned before, we're still going to have an activity with the Ministry of Health. And so we have to respect the time rigorously. And the first question that we have here is for Dr. Nadia from Spain. So from your initial analysis of the participation of the Brazilian government in the human milk banks policy. And so we have heads of government here and also heads of state from the Ibero-American region. So shouldn't we try to mobilize ourselves and try to get more sustainability in our work? Dr. Nadia, the floor is yours.
Perdón, ¿en español, English o español está bien?
Em espanhol. Temos tradução em 3 línguas.
You can speak Spanish, please. You can speak Spanish, please. No problem.
Sí, claro, por supuesto.
Okay.
Creo que...
So thank you. Yes, I agree with you. I understand that the question is, so shouldn't we together mobilize ourselves so that we
de la
can
lactancia y la donación de leche?
Receive more support from the government regarding the HMBs, right?
Daniele.
And the HMBs network. Did I understand
Álvaro.
my question? Yes, exactly. That's exactly it. And so since the initiative by UNICEF, I know that we have been trying to find and to establish contacts with the Ministry of Health here in Spain. And it is true that all of the topics, we started working in terms of regulation of the HMBs, but what we noticed, so we wanted to wait a little bit until the European regulations and rules were all set forth. We were waiting a little bit for that. And so we wanted to continue the work that we were doing jointly. And so we're going to try to continue working together, mobilizing everybody so that we can strengthen our work. But we were waiting for the European legislation, okay? Yes. Thank you, Dr. Nadia, very much. And so now I have a question for Dr. Sitaranã. So from the experiences that you had during the pandemic, what would be your suggestion so that we could strengthen the network of the human milk banks within the BRICS? Dr. Sitaranã, the floor is yours. Did you understand the question?
Means you want to basically understand that how we can build up our network to promote the collection in the milk banks, is it? Yeah, I see the
within the BRICS, sir, within the BRICS
okay,
countries,
within
sir.
the BRICS. Okay,
Yeah.
Wonderful. Yeah, actually the thing is we have found that promotional materials of educative materials and very good quality videos on every aspect of breastfeeding and milk bank banking, which are very simplified, has to be uniformly spread around all the BRICS countries, which can give an idea that some of the countries where the facilities are not there to create such simplified information brochures it can be, shared by members. So everyone has done something in parts. Well, if we can all correlate that material, that will be a very good kind of a material to be circulated in the BRICS community. And especially for promotion, we come out with a statement which is quite uniformly accepted. Every country has its own way of looking at the problems. But I feel that like WHO and UNICEF, most of them are giving some recommendations. But if our own bodies do have clear-cut recommendations based on very sound multi-centric research data, which then we can actually convince our authorities in a much better manner. Because it has to be, for example, including the vaccination, for example, you find that all countries have a very different way of looking at it. Some people go aggressively in looking into for pregnant ladies. Some, like ours, we have not even decided whether pregnant ladies have to be given any vaccination. These kind of things have to be looked into more carefully, and this can BRICS collaborative efforts can help in most of these studies like this. Yeah. Anything else to be clarified on that? Yeah.
Não. Obrigada, doutor Sitaraman. Eu vejo aqui que o doutor João
No,
Aprígio...
thank you, Sitaraman. I can see here that Dr. João has his hands raised, so I'll open for him. My friends, good afternoon. I couldn't leave this session without greeting you live, even at a distance. It's a great pleasure to see you. Friends that I haven't seen for a long time, some more, others less. Nice to meet you, Sharon, Tanya, to see you again. Yeah, and so much time since the 12th of October. And to the friends from Spain, Sitaraman as well. Good. I remember very much our last meeting in Brasilia. I hope we have the opportunity to do so more. And in truth, I'd like to thank you for this opportunity of being here together. And I believe, and especially with you and you, Nadia, to remember that this morning we had the opportunity, we talked about a theme that is very sensitive to all of us that work with HMBs, which is the word sustainability. Sustainability. Sustainability, so we can advance in a technical sense, so we can translate in benefits for our population. The sustainability is extremely important because we need financing, financial resources to make these public services viable. I remember, Nadia, in the last forum, the work presented by your group was very rich. Projects on quick pasteurization, a series of aspects that were fantastic, and I'm very proud. And as a part of that family that received me so well. So I can't leave this without registering this and mentioning Sitaraman as well, because we have two important spaces where we talk multilateral coordination spaces. And if I'm not wrong, and near Siberia,
da Secretaria-Geral Ibero-Americana.
Ibero-American Secretariat is an important forum of political coordination of chiefs of state of the Ibero-American region, of which Portugal and Spain and all Latin America are included. And last week we had a meeting with Dr. Rebecca Klinsman. And they have a very strong view in terms of human milk and other issues. And they seek to promote a greater integration, articulation. And the issue is in the same line and not so advanced. We have the BRICS. We were run over by the pandemic. We weren't able to advance with our coordination. So I ask, putting more like a suggestion for you to do this internally with your peers, and that we that are from the Ibero-American here, that we can, in terms of your very caring suggestion, I understood it very much, about looking to Brazil, that Brazil has of an investment. I believe that, yes, we could work in this space from our directors to take this idea of getting more and more articulation so that we might have a line within the block that supports us, that strengthens us, a space within in the Ibero-American space. So that would be like a small seed. I don't know enough of this yet, the BRICS, to put forth my position. But what I would like to hear from you, if it's valid or not, a proposal of that nature to bring this discussion internally. And as I have the responsibility of conducting of the Ibero-American program, I would be very happy if we could take at this same level to the Ibero-American. Maybe Straman could bring his colleagues and we could take it to the BRICS. Pasteurization for us is only the milk. We don't want to pasteurize our autonomy or the way we work. What we have, we need, or we feel the need. We talked about empathy this morning, of generating opportunities. Our networkers, as locations, our banks continue to grow. So it'd be very interesting and to hear very quickly if you think it's pertinent. We could go through that path, seeking that. And Sharon, I'd like to take the opportunity to thank you personally for the hard moment that you're going through, and that you are here despite that in an act of solidarity and helping here with our global work. So thank you very much, Sharon. I would like to see if
Thank you. Thank you so much.
if Nadia and colleagues, if you think it's pertinent. Sorry to take away from the debate, the questions, but I couldn't leave an opportunity like this go past and observe.
Sigo aqui, tá? Só fecho a câmera. Estou ouvindo vocês para não roubar a cena aqui.
Okay. I'd like to hear from you.
Microfone fechado, Dani. Microfone fechado.
Thank you, João. Winnie are asking about the models, if they are the same principles. I think in João's speech that we share the principles, we don't pasteurize the models for HMBs. I lost here. I got a little bit lost in the questions. I would have a question for Dr. Tanya. Let me see if I can find it.
Mari, você pode me ajudar aqui, copiando ela aqui de novo? Porque o movimento está muito grande do chat. Peço perdão aqui, mas... Bem. Achei aqui. Tânia, essa vai para a doutora Tânia, partindo da premissa que somos, acima de tudo, uma rede de
We are,
pessoas.
above all, a network of people. And I think that in sociology and anthropology, we have a lot to do in terms. So in your perspective, what would be the first step? Dr. Tanya.
Thank you, Danielle. The first step, I think actually part of this is what's been happening through the pandemic, which is communication. And Jillian talked about the network, the WhatsApp group. Technology has actually brought us closer together in many ways than we've ever been, even though many of us have not gone further than 5 kilometers from our home in the last several months, particularly in Ireland, where we had one of the longest lockdowns in the EU. It's another point that we can be, I suppose, proud of in terms of things, because we also presented that in terms of saving lives and doing this to actually save lives, which part of what I was trying to think about as a social scientist is that there are many different stakeholders involved in this, and we don't want to ever forget voices. And one of the things that I found invaluable years ago when I first met João in Portugal was for the first time ever, I saw adult children or teenage children who had received donor milk. And that was part of his presentation, to show those older children. Now, I do that as well, partially because that one of those children, the one that Jillian showed and the one that I put in the end of my presentation, is now, he's my son, and so I take his picture as he gets older and have his permission to be part of that. But I do think it's part of thinking about a future. And when you actually, the emotional content of thinking about the babies and the mothers is one thing. But these, as one of the donors pointed out, she thought about the person those babies were going to become, who one day could be a doctor, could save people, could marry their children, so on. We need to think in terms of future, and communication is across disciplines, across countries is key. Thanks.
Essa palavra para você, João.
João, I hand the floor to you. In reality, I would like to make a quick comment, Tanya, on your considerations. And the part of anthropology, sociology in medicine is a part that interests me. There's an interesting research line and in building knowledge and in feeding children in Brazilian pediatrics and with the importing of knowledge and practices. So looking at that line and this millenary concept and bring it to our concept of human milk banks and living day by day with this joint of experiences and testimonials that are strong or rich, I ask myself, up to what point, or in another way, I'm aware that we've advanced a lot in the clinical aspect, that it's, and that the reason for our greater existence is to favor the clinical evolution of our newborns. And in reality, we know more and more about less and less until we know everything about nothing. So when we believe that we advance so much, we end up discovering other opportunities. And I remember, for example, in a recent story where I found an intensive care unit with so much human presence, treated as family, and not only as visit. I was enchanted because we heard a lot about this speech and we look and after 36 years, I ask myself, we've advanced a lot in the biological world, but in the human relations, we have a lot to do. And we need, like we have very dedicated professionals that go to microbiology, clinical, technology, and all these important sets of knowledge that are so fundamental. In reality, where can we start and advance putting this of our clients, scientific knowledge, innovation, the development of technology in order to allow that we grow? I think that we need to amplify a little bit more on that. I was thinking a lot here when I was listening to Sharon, and I was looking at Sitaraman. I listened Sharon, and I looked at Sitaraman. Why? Because I went through a lot of my life studying and dedicating to the concept of feeding and nutrition. And I would look at Sitaraman of the millenary wisdom of his culture, of Sitaraman's culture. It's not centuries, but millennial, about food and medicine. And if we come to modern medicine, we go to Hippocrates, which has great quotes. Let the food be your medication and not your medication be your food. Sharon, that comes from the biochemistry and worked the concept of food as being medicine. And then we think, and I agree with you, when you put that human milk is a tissue, a living tissue, but a question to share with you, considering all of the advances that we have today in the science, chemistry, molecular biology, all of the reach that we have in the recent studies, the most recent studies on the microbiome of the human milk, We don't even talk about microbiotes, flora. No, it's a microbiome and its relationship with the epigenetics and the relationship with epigenetics and how this microbiome is effectively the human milk with this concept of food and this part of the food codex and the quality necessary. But beyond the nutrition,
sobre essa possibilidade, né, de a gente olhar para além de tecido, né, da gente considerar desse importante papel de um alimento funcional, de um alimento inteligente, sobretudo voltando, quer seja pela sabedoria ancestral aí que nos representa aqui, o que o Citaramã nos autoriza a mencionar, entre aspas, só citar e não mencionar. Então, eu acho que são pontos, já que a gente pensa na rede, o que podemos fazer a mais, eu acredito que falamos de pandemia e o que podemos fazer a mais, penso que esses seriam pontos de reflexões para serem compartilhados. Não são os únicos, mas são alguns pontos. Gente, eu tendo a falar demais e peço desculpas por isso. Por favor, estou fechando meu microfone e minha câmera, sigo aqui só ouvindo. Muito obrigado. Muito obrigado a todas, a todos.
Obrigada, Dr. João, pelas suas
Thank
palavras.
you, Dr. João. Thank you so much. We are running against time, and I apologize. Dr. John was saying that he apologizes because he speaks too much. So on the first day of the event, the human milk banks showed what they can do more. And during the pandemic, everybody had to reinvent themselves. This is a word that they had to use regarding the communication with the donors, communication. And I saw this on Dr. Nadia's presentation. She mentioned the social media, new type of communication with the donors during the pandemic. So during the pandemic, during Dr. Nadia, was there a difference? And so how did you structure this? I'm going to start in the same order that we used before here on the panel. I know, so let's start with Dr. Natalie.
So social media was hugely important in terms of communications. We were putting out communications in January about what we were understanding from expert advisors, but really starting the networking at that point in time. But I think it's...
Nathalie,
can you hear me?
a pergunta nesse momento era para a doutora Nádia, desculpa.
Sorry,
Oh,
I've lost translation.
Oh, I'm sorry, Dr. Natalie. The first question was for Dr. Nadia. I apologize.
Oh, you said Natalie, okay. Sorry.
I didn't understand the question really well. Sometimes I get a little lost with the Portuguese. I apologize. So I'm going to repeat the question, no worries. So during the pandemic, okay, we had to have the social distancing, the physical distancing, and the lockdowns. So how was your communication with the milk donors? Sometimes the milk donors, they would go to the centers to donate milk. Sometimes you collected the milk using a car. But how was the communication with the donors? Communication with the donors. Yes, communication with the donor. Well, via many apps and messages, emails, using the telephone. And so we wanted to make the communication take place. And we had many communication campaigns so that we could emphasize how safe it was to donate milk, how secure it was to donate milk, how important it was for them to continue donating. Did I answer you properly? Is that it? Yes? Yes, thank you. Thank you. and the responses and the answers, they were wonderful, and the community responded well. Okay, and that's how we use the communication means. Thank you. Thank you, Dr. Nadia. Now, Dr. Jillian, please, I would like to pass the floor to you.
Thank you, Danielle. And I'm not a doctor, so please just call me Jillian. I don't wish to elevate myself. So to answer the same question, I think that social media has revolutionized human milk banking because, and particularly it's been so very useful since the pandemic because it's enabled us to communicate very, very rapidly with our colleagues around the world as well, and to promote and to share what we're doing and to learn from others as well, but also to be able to communicate with the mothers who give us their milk and the families who receive the milk. And so all of these communications are so key to what we do. We can't have milk banks unless we have donors. We need to be able to give them the changing information and to be able to support them and inform them. It was very interesting to hear how important the messages were in India to ensure that mothers were willing to donate and willing to accept the donor milk. But for me, global communication is key. I think we have so much to learn from each other, and there's so much I think that we don't necessarily understand yet. And so whether it's social media or more traditional media, but the instant nature of social media, you know, you send me a message, it's there on my phone, and you know, you will get an answer. You send me a letter or an email, and maybe it'll take a little while. So the immediacy of it has worked, you know, really well because it's what we need. So you know, I think it's a real game changer, and I think that without it, the reactions and the contributions towards overcoming the challenges of the pandemic, you know, we just wouldn't have been able to cope with it. And the other thing is, you know, everybody's got this in their pocket, you know, so just about.
Obrigada, Jillian, pela sua
Thank you, Jillian.
Daniel, a point here. I'd like to make a point here.
Ok, Dr. Taraman.
Yeah, means I think what Jillian has mentioned and what Nadia and everyone has basically mentioned, it's very important that when you're using a social media and how to project your the donation of the milk as a part of what? As a food or as a medicine? I found that in the current pandemic, the way the people have actually used the social media in saying that donate milk to protect a child and save a child, especially those children whose parents were affected with COVID or died. There's quite a number of orphans here, which they were actually there. So it's not just the food, it's also projecting milk as a immune booster, because these days people are really keen on having things for immune boosting. And I found that the milk being projected as a immunity booster and a medicine against this pandemic would be a message which should go throughout the BRICS countries and practically globally, rather than just considering it as a food. Yeah. Jillian, yes.
Bem,
you're
a
right.
Gillian
We need
levantou. Gillian, antes de passar a palavra para você, eu gostaria
Before
de...
passing the floor to you, Gillian, I would like to follow the sequence, and I'm going to pass the floor to Natalie and then to Dr. Sharon.
Peço que fale pouquinho.
Natalie, the floor is yours, okay? So please speak a little slower.
Thank you. I will be very brief, but I completely agree with the words that were just said. And I think this has been the real, the moment that I think policymakers are understanding what human milk is actually for. I think breastfeeding has had a fairly terrible reputation, certainly in the United Kingdom, where I trained and grew up. And I think those public-facing messages around not just antibodies, but the wider function of feeding babies has changed how milk banks are being perceived. And certainly the conversations we've had with policymakers in the last month, I would say, have been incredibly different to those of the last few years, without doubt. And it'll be interesting to see whether that's reflected globally, but it could be an interesting time.
Thank you, Natalie. Now I would like to pass the floor to Tanya.
Thank you. I was just going to add that we need to also remember the people and the relationships behind this, and not just the milk. The science does sell itself to policymakers, but as Joelle pointed out earlier, we need to also have policymakers value the breastfeeding relationships that underlie this. And so we need to have that value go to those relationships and not just disembody the milk. Now, it's clear that that does have value, and thinking about it from a knowledge perspective is wonderful, but we need to recognize and share both. And I think that's where we can have all of these components influence policymakers.
Com certeza.
Yes, absolutely, Tanya.
A Gillian tinha levantado.
Gillian, she had raised her hand. Would you like to say a few words, Gillian?
Well, I was just going to answer Dr. Sitterman really, and just to say that, you know, yes, indeed, but we can get any message across that we want. We need to agree the messages, I think is important. But indeed, breast milk, as we've learned over the last decade or so, is so much more than just a food. And in these days when vaccines are, you know, on everybody's lips as a topic of conversation, you know, we should remember that breast milk is nature's first vaccine, and that it's a multi-vaccine. It provides protection against a whole range of diseases and infections. And what a powerful message that is. The social media campaign that the European Milk Bank Association has been running over the month of May in support of World Day of Human Milk Donation, I was astonished that before the end of the first week, so after 5 days, the Facebook and the Twitter had been viewed by over 100,000 people. It had landed on the social media of 100,000 people. And this is a campaign that is thanking donors for their donation. There's no other way on this world other than using social media that we can instantly get that message out. So as long as we all agree the message, then, you know, it can just be the most powerful tool that we have.
One remark about what Dr. Tanya said, and going back to Dr. Nadia's presentation that discusses an initiative of immunization. So before thinking before thinking about the milk, we have the woman, we have this humanization aspect, we have the promotion for breastfeeding. Before anything else, we want this mother to breastfeed their own babies first. So getting a little bit of the presentation given by Dr. Nadia that talks about this humanization of these services, and also getting a little bit of Dr. Sharon's reality. I believe she had to leave, and she's now living in a very difficult environment. We are discussing what else we can do during the COVID-19 pandemic, but we're speaking in global terms, but we still have to face many, many problems in many other countries. We had a live example now that is Israel. They are going through a very difficult problem now with missiles, with bombs, and we are all going through the pandemic, this invisible virus that it has impacted our countries drastically. And also cultural aspects, the interculturality, all of the countries. And discussing this is also important. We live in different cultures. When Dr. Tanya said that the photo that she showed is her son was in that photo. So at the same moment, I saw and I envisioned many stakeholders of this network that used to be these babies that used human milk many, many years ago, and now, and they started becoming healthcare professionals, and they work in this network, and they experienced this. They went through this process. They had their babies, they breastfed their babies, they are donors of milk, human milk. So this is the movement. And one word that we can share and that we shared today and we shared yesterday is a feeling that this is a network of people. This is a network of people. It's not only the healthcare professionals that form this network. Each mother, each baby, each recipient baby, each baby that is going to become my daughter's friend, a doctor in the future, who's going to be a journalist, who's going to try to find out more about human milk, they are part of this network. Now I'm going to pass the floor to Dr. João Aprígio. Dear friends from the session, there is a question here as well that should be asked to all of the panelists, okay? All of the panelists, and it's a very important point. It is the suffering because they lost a baby, that is a concrete situation, and it's an opportunity when people are suffering, when people are grieving, in some situations, in some different perspectives about this aspect, this difficult aspect when the mothers, when the women, they lose their babies. And for an unexpected reason, they lose their babies. And as a solidarity act, they try sometimes. We have stories that come to us of, and so they donate the milk. So the question, without trying to generate a polemic topic, and the question is simple, but it's not simple at all. How do you, all of the panelists in each one of your countries, in each one of the places where you work, how do you deal with this issue of the loss of babies? We understand that human milk banks, they are a support, a home for breastfeeding, but we are not, we welcome the mothers, we welcome the donors, okay, and we try to do the best work we can. So how do you, in your countries, in your organizations, Not necessarily you, but how do you work this topic when a mom loses the baby? Loses the baby, where you work in your countries? Thank you. Daniele, this is an important question, and many people are asking it. It's not a question, but maybe something that we would like to share. We would like to hear all of the panelists on this topic, please. Okay, João, so let's follow the same order as the presentations, please, because it's better. Once again, Dr. Nadia, okay, you can go first. The floor is yours. Thank you.
Perdona, Daniela, no había entendido. No he entendido la pregunta, perdona, que estaba...
Sorry, Daniela, I didn't understand that question. I was distracted. And the problem, the loss of the child, because this is a problem. So how do you deal with this theme in each of these countries? Thank you, Nadia. The truth is that in Spain, we gave an important step in terms of any grief. I think neonatal death is pretty recognized, and the recognition of the support and the donation in that context. There is a very strong movement at the social level. There was a demand by the women, and some years we support this. A working group in the association, and a very strong support by the association. And that there's a recognition ever more in society, and we support, we are more aware of the mutual benefit for those milk banks and women or neonatal deaths, etc. Thank you, Nadia. Now we hand over to Gillian.
Thank you. And I couldn't agree more. This is an incredibly important question and something that is really very valid to be able to discuss between us. I think what we need to do is maybe take a step back before we're faced with a mother whose baby has died, whether the baby has died postnatally or just very close to delivery date. We need to make sure that all of our colleagues who will be in contact with mothers in this situation understand the options that can be presented to any mother in these circumstances, that she should have choices and she should be supported to make the choice that is right for her. And in order to be able to do so, first of all, we need to acknowledge that in this situation, women are going to have, or often going to have, a milk supply. They may have been working very hard to establish that milk supply. They may have spent the last days or weeks expressing very frequently to establish a milk supply so that they will be able to feed their baby. And then all of a sudden, their baby dies and they're left with their lactation, and they need to know what to do physically to help themselves, to make sure that they don't suffer any problems as a result of this. This usually means that they need to keep on expressing their milk. And when women have their milk supply established and they have milk already expressed and frozen and stored, to somehow try to ignore that or to suggest that this isn't important and valid anymore, I think is to do these women a great injustice. I think we also need to remember that this is part of a physiological process and that the reproductive cycle doesn't end when a baby is born. It ends when the lactation ends. And so physiologically, there is a need for the mother to be supported. And in order to do that, there needs to be education about the options. There also needs to be training and education for everyone who works in the milk bank, because the milk bank staff may not be the ones who are in contact with the mothers, but they need to have training so that when they pick up the phone to a mother who is grieving and who may take several conversations to be able to fully explain what she wants to do or to find out the information she needs. They need to know, I believe, that every piece of information that is on a website or literature that is provided for donors needs to take into account that different donors have different needs. We cannot always assume that donors come from the same happy situation of, a thriving baby and they have some surplus milk. And I know that one of the important things that we've done in the UK is to ensure that we have separate questionnaires, we have separate information leaflets, we have separate information on the website. And so mothers in different situations can go down a different route. The other thing is that nobody should be being seen. I don't believe anybody would try to coerce mothers into donating their milk if they didn't want to. But we also need to make sure that we're not seen to be doing this, that what we always want is the best for the mothers. For some mothers, the best thing ever in their awful situation will be to be able to express and donate their milk. I remember very vividly one mother saying to me that the only reason she got up in the morning after her baby had died, the only reason she got up in the morning was to express her milk for the milk bank for the other babies. And it gave her, a reason
Obrigada,
for
Julia.
everything. So, just making sure that all our staff, all our colleagues are prepared to be able to have these conversations, and that everyone in contact with bereaved mothers knows the options and knows that this is one thing that mothers can do if they choose to.
Obrigada, muito obrigada, Julia. Passo a palavra para a doutora Sitaraman.
Thank you, Gillian. I would like to hand to Dr. Sitaraman.
What Jean has said is an extremely important message we have to convey. We have had one or two experiences like that, where mother did not come for donation, but she had a lot of breast engorgement, and she sought the help of our counselors in our management center. Once that was there, the only thing my counselor was that this milk can be used for another child. And literally there were tears in the mother's eyes. And she said, yes, I could not do for my child, but if this can help another child, it will be done. It can be taken for that. And she, as long, because she had some OBS problems, so she had a longer stay in the hospital, and through the time she was donating the milk, despite the fact that her child died. What I would like to state here that we should make a link between the whole concept of organ donation, which we have as concept for saving lives, should be translated into milk donation being a equally important aspect of saving a life. The way we have a trust in most of our societies, and which is now getting increasingly accepted by the society, that organ donation is by anyone is extremely important. The same way, I think milk donation can also be, given a parallel philosophy.
Obrigada, doutor Sitaraman. Por fim, doutora Tânia.
Thank you, Dr. Sitaraman. Finally, Dr. Tanya, the word is yours. The floor is yours.
Well, thank you very much. I'm sorry that Sharon is no longer here, but I'm going to take this opportunity to also mention some of the wonderful work that we've been doing this year with Dr. Aliya Dorag, who is a researcher in Israel who wrote her PhD on bereavement and donation from the United States. I met her when I was doing my Fulbright in the United States, and then Aliette and I continued our conversation back in Europe, and we continued working on thinking about the issue of bereavement and donation, a topic that I personally, like Jillian and so many here, have spent a long time thinking about. Jillian and I actually also worked very closely to produce, she mentioned some of the PATH toolkit things for human milk banking, of which one is about bereavement. And again, it's a couple of years old, so it doesn't capture some of the recent work that has been done in relationship to this. I think from a staff perspective, Jillian's points are all incredibly important. From an anthropological perspective, I would also add that there are different perceptions about birth and death in many cultures, and the integration of birth and death and how important that becomes. Those are also connected to part of what was also mentioned in terms of meaning and memory making, and how that can be part of those components. The last point I was going to make was about organ donation. I do know that in some places, neonatal organ donation is not allowed. And so if you actually link milk donation to organ donation, you then have parents who are unable to donate organs for their neonate, but could donate milk. So we've got to be aware of some of those things as well when we're thinking about this. But I do appreciate that it was a topic that was brought for all of us to discuss, because it is one that is the whole reason why I started working in this world, because my first son died. And that's why I started working in this world. So, thank you.
Nós que agradecemos, doutora Tânia. Passa a palavra agora para o doutor João.
We thank you, Dr. Tanya. Dear friends, some more recent, it's an enormous pleasure to be here in this session with the certainty that opportunities like this will be repeated and that we should learn, since we are interested in discuss what to do more. I think one of the things that we should do is exactly generate spaces like this with greater frequency and not to wait help to come each century. So in reality, in truth, a feeling of a lot being accomplished, that we're finishing the day today with a feeling of great joy and great care for all. And this session, I'd like to invite you for our closing session that will happen soon after. It won't be a closing session, but an official session of the Ministry of Health of Brazil, to which I invite you to join, because our highest authority in health will be here for the official launch of the Brazilian campaign of human milk donation 2021. Receive my digital hug or greetings. I hope it gets to Nadia, if you could hand it over to all in the 12. Greeting to you, Tanya. I hope it gets established, that we can do a lot of things together. Gillian, always a great partner. And Mr. Sitaraman, our home is your home. As soon as this pandemic ends, so that we can really see to hug like Latinos do in a very fraternal way and live.